If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, what is the best non-medical way to reverse type 2 diabetes? Answer by Wayne Bodelick. I'm going to start by assuming that by non-medical, you mean without medications. But technically, what I'm going to offer is the medical treatment for T2, type 2 diabetes mellitus. Next. There is no reversing T2. There is controlling it. My issue with the reversal term is that you cannot change your genetic makeup, and if you have T2, you have the genetic makeup that causes it. The genetics cause a biochemical problem wherein the cells of the body do not respond efficiently to the action of insulin. This condition constantly increases over time, though it starts at different levels for different people, and progresses at different rates. Insulin's job is to facilitate the transfer of glucose from the bloodstream, the body's delivery system, into the cells, which need it for fuel. When those cells resist that transfer, too much glucose gets left behind in the bloodstream. While there are steps to alleviate the elevated BG, blood glucose, levels, there is nothing to alleviate the cellular resistance to insulin's action, though it can be improved. Initially, before diagnosis, a T2S system will produce more than normal amounts of insulin to overcome the cellular resistance, and this works for a while. But in time, as more and more insulin is needed, the pancreatic endocrine beta cells, the tiny part of the organ that makes insulin, can no longer make enough extra to keep up with the demand, and that's when the patient gets diagnosed. Also, over time, due to the constant condition of insulinemia, an excess of insulin present in the system all the time, T2S experience a gradual decline in beta cell mass and functionality, leading some to produce declining amounts of insulin after they've been T2 for a while. This doesn't happen to all. So, while there is nothing to be done about the underlying, genetic, cause of cellular insulin resistance, there are two primary steps to be used to control BG. First and foremost is usually described as diet. Unfortunately, this is a very vague and meaningless term. For diabetics, of any type, it's all about counting carbohydrates, or carbs. In T2S, carb limitation is the first and best step in limiting BG levels. Because carbs are the primary source of glucose in our diets. The other two sources of macronutrients, proteins and fats, produce only very small amounts of glucose, so by limiting carb consumption, you limit glucose excursions. But how much to limit carbs is a very individual thing. Each person must learn for themselves how many carbs they can tolerate at each meal. You learn this with a BG meter, by testing before and after meals. You learn how many carbs you can eat and not exceed your BG target range. Each patient is supposed to get a BG target range from their doc, based on their personal circumstances. But the ACHI, American Association of Clinical Endocrinologists, the docs that specialize in treating these, recommends, for an otherwise healthy individual, a range of 80 to 140 mg/dl, with a fasting level of no more than 110 mg/dl. The low end of that range is the fasting and pre-meal level, and the high end is the peak after a meal, about 1 hour after for most folks, but anywhere from 45 to 90 minutes, we're all different. The second, and also very important step in controlling BG, is exercise. By this, we mean any kind of regular physical activity. By regular, we're talking about a minimum of 30 minutes on 4 or 5 days a week. By maintaining this regimen, you improve your cellular response to insulin. Active cells are insulin receptive cells. So getting into a routine and maintaining it is key. This step is addressing the underlying cause of the disease, and helps immensely. Activity also burns off BG. But that's not the primary point of it, though it's a good thing as well. The real point is to get your system to respond more effectively to insulin's action. Over time, if you can increase the activity session's frequency, duration, and intensity, you will increase your insulin sensitivity. So, for some more specific guidance on all of that, here's some links. Carb Counting for Beginners, https://www.bd.com/resource. Asks, Carbs by Foods, generic list, use labels if available, http://www.med.umich. edu/1libr/m. Getting started. A good outline of T2 management tactics. Getting started. Testing with purpose. Use your BG meter to control BG. Test, review, adjust. So, the short of it is, diet and exercise. But that's too vague, so Eva buried you with some details. But it does work to control your BG, and even to get it into normal, non-D, range. And, incidentally, all T2 oral meds require the use of diet and exercise as well. To be effective, just read the fine print in the paperwork that comes with them. I hope this helps. Answer by Shauna Ishans. I had to stop reading after I saw 2 responses with sentences that said you can't reverse type 2 DM. Baloney. I have seen it happen many times, and this is a victim mentality to say that it's impossible to reverse it because of genetics. Is it possible for every person with DM2 to reverse it? No. Is it possible to reverse and cure DM2? Absolutely, when done properly and when not too far progressed. There is no better medicine than diet and exercise, plain and simple. There are various supplements I may use to support the liver, balance blood sugars, or other organs that need support, but this has to be done with proper diet and exercise. Answer by Luis Doriocourt. Can't do it, because there is no true reversal of diabetes regardless of the type. With T2D it is possible for some people to become medication-free with certain lifestyle changes. A low-carbohydrate, high-fat diet works for many, accompanied by physical exercise. Carbs will spike your blood glucose regardless of whether they are simple or complex. The LCHF diet combined with physical exercise will help one to lose excess weight. Abdominal fat tends to cause the person to be insulin resistant. A third leg of this is to get stress out of your life. Doing the above will improve your health and may bring your sugars down to normal. The important thing to remember is that T2D is progressive. I was in great control for about 12 years with diet and exercise. Then my blood glucose spiked and I couldn't get it down. I restarted orals and soon was on Lantus insulin. The important thing is to take control by self-monitoring and keeping that sugar down so it doesn't destroy your body, mind and spirit.